Hallux rigidus is progressive arthritis of the big toe joint, often affecting athletes, but also can affect really anybody, and creates pain and stiffness at the big toe. Hallux rigidus is diagnosed from clinical exams, so looking at the patient, the doctor will look at you, move your toe around, and assess how much motion you have, and then often we'll also get x-rays to take a look at what's happening underneath the skin. A bone spur is basically a projection or a spike of bone that forms over the top of the joint, and what you'll see is a bump on the top of your toe, and that's often quite tender and sensitive, and on the x-ray you'll see it as a bump on the bone itself. Hallux rigidus is in part just due to your genes, so you can look at your family history as a cause. In addition, to some extent, it's overuse injury, so it's repeated stress on the joint, and it can also come from having an injury to the big toe that over time develops into arthritis. Hallux rigidus is treated a number of different ways. At first, oftentimes, it's just modifying your shoes to a little bit of a stiffer soled shoe so the toe doesn't have to move as much. Anti-inflammatory medicines like Advil, ibuprofen can help to relieve the pain, and when it gets more severe, then we talk about surgical treatments. So surgical options include what's called a chylectomy, which is a clean-out type procedure where you shave away the extra bone and help to improve motion, and sometimes that's combined with an extra cut in the toe bone to help with motion. And then another common surgery for this is a fusion procedure where we lock the two bones together, and that's very effective for relieving the pain. There are some other procedures that try to put a spacer between the bones to cushion it more, but the most common are a clean-out procedure or chylectomy, or a fusion or arthrodesis procedure. It depends on the specific surgery, so a clean-out procedure may only take a couple of days before you're back up on your feet, although swelling may last for even a couple of months. If you have a fusion procedure, you'll often need to protect the foot in a special shoe or boot for up to around 6 to 8 weeks, and then slowly after that you'll be able to do more and more activities, but oftentimes it's about 3 months or so before you're really getting around and doing a lot of the activities that you'd like to do. The risks of surgery are like any surgery, so anytime you make an incision in the skin to take care of a problem, there are some risks of infection. There are risks of damage to nerves or blood vessels, so there's not a whole lot to worry about in the area that this surgery is done. You can end up with stiffness, or the arthritis can get worse if you just do a clean-out procedure. Sometimes the fusion or the locking of the two bones together doesn't heal and needs additional surgery to get that to heal as well. Hallux rigidus is a problem of the big toe that's caused by arthritis that limits motion and often causes pain and interferes with function.